Hi, my name is Emily Pazmiño. This is Medical English, and today I'm going to talk about molecular genetic anatomy and risk profile of Hirschsprung disease. Definition. This is an obstruction of the large intestine. It occurs due to deficient muscle movement in the intestine. It is a congenital disorder which is present at birth. In Hirschsprung disease, nerves are absent from part of the intestine. The areas lacking such nerves cannot push material through, causing a blockage. Intestinal contents build up behind the blockage, and the intestine and abdomen swell as a result.
Hirschsprung's disease is a congenital abnormality of the colon where the nerves to control bowel function don't make it to the place they're supposed to make it. What we find here at Shriners is that a lot of these kids are difficult to diagnose, difficult to treat, and we've developed a specialty center at Shriners Hospital to provide care from the time of initial diagnosis all the way through potentially a lifetime of bowel management. And we are here to take care of every aspect of their needs and their surgical care, their medical care, in order to restore these children to health on behalf of Shriners and for our community.
Applications in medicine. Numerous congenital anomalies associated with Hirschsprung disease have been described, some forming disease or syndromes and other isolated, including congenital neuronal dysplasia, Down syndrome, Kaufman-McKusick syndrome, congenital central hypoventilation, cardiopathy, deafness, pupillary dilatation, ocular pigmentation, bone dysplasia, renal and urinary tract malformations, intestinal atresia, microcephaly, meningocele, epilepsy, and insulin resistance.
I am Dr. Luis de la Torre, Assistant Director of the International Center for Colorectal and Urogenital Care at Children's Hospital, Colorado. The patient with Hirschsprung is born without ganglion cells in the rectum. Thus, it is a congenital problem. All the patients with Hirschsprung cannot relax the rectum, resulting in a blockage. The patient cannot move out gas and meconium. Usually, the newborn passes meconium in the first 24 hours of life. If this meconium does not occur, we must suspect Hirschsprung disease. Also, it is mandatory to suspect Hirschsprung in the newborn and young infant with abdominal distension, vomiting, which is not having regular bowel movements. These symptoms are frequently confused with constipation, food allergy, or food intolerance. If this misdiagnosis is established, the patient may develop a life-threatening condition named colitis. The majority of patients with Hirschsprung does not have other clinical features. Then, the clinical history is enough to suspect this condition. It is essential to confirm or rule out Hirschsprung disease as soon as possible in the newborn and young infant with an early onset of constipation. Furthermore, if it's associated with vomiting and abdominal distension. Once the suspicion is supported, the patient needs an abdominal X-ray and a rectal biopsy. The X-ray is needed to evaluate the dilation of the large bowel and helps to assess the severity of the obstruction. Also, the severity of the colitis. In many cases, our preference is to start medical management with rectal irrigations before the biopsy. Once the baby is in good clinical and radiological conditions, we proceed to obtain the rectal biopsy with a special device. In 24-48 hours, our expert pathologists informed the result of this study. If pathologists verified the absence of ganglion cells unobserved associated nerve hypertrophy, the diagnosis of Hirschsprung is confirmed. Normally, we continue the medical management with irrigations in these babies until the patient has a acidic yellow stool, is eating well, and is gaining weight. This clinical feature means that the baby does not have colitis, and it is the proper time to perform the contrast enema. This radiologic study is performed with a unique technique for Hirschsprung. The goal of the contrast enema is to demonstrate the spastic rectum or rectosigmoid followed by a dilated large bowel. We call this area the transitional zone. We can estimate the length of the segment with Hirschsprung disease and plan the type of operation. The contrast enema should be done when the patient does not have colitis. This condition allows demonstrating the transitional zone. The contrast enema is not useful if the patient is suffering colitis, even with subclinical colitis. At the International Center for Colorectal and Urogenital Care, we are confident that the diagnosis of Hirschsprung disease involves the histopathological demonstration of absence of ganglion cells in the rectum and the length of the ganglionosis. This comprehensive diagnosis allows planning the best surgical procedure to repair this condition in every patient.
Pros and cons. For the pros, most children with Hirschsprung disease recover very quickly from surgery without many side effects or complications. For the cons, children who have Hirschsprung disease are prone to developing a serious intestinal infection called enterocolitis. Enterocolitis can be life-threatening and requires immediately treatment. Another cause is female because Hirschsprung disease is more common in males.
Zsolt Varga was born on Valentine's Day in 1995 in Hungary with a condition doctors there were unfamiliar with. He had Hirschsprung's disease and complications related to the painful and sometimes life-threatening gastrointestinal condition that blocks the intestines.
My doctors tried to find a solution, but my condition kept getting worse.
He had surgery as a toddler, but his condition worsened again in 2001 to the point where he had to be transferred by medical helicopter to Budapest for care. Even that wasn't enough. He wasn't getting better. His family posted flyers and turned to social media for help. His community rallied around him to raise money for him to travel to find better treatment. His doctor referred him to experts from Cincinnati Children's.
We first met Zsolt and his family in Serbia. We had a medical missions trip through the colorectal center here at Cincinnati Children's. His surgeon had initially contacted us to see if Zsolt could come to the United States. Hirschsprung's disease is a relatively rare disease. We, as a center, see many of the complicated cases. We have patients that come from all over the United States and internationally.
The Cincinnati Children's team did an initial surgery for Zsolt in Serbia, but he needed a second-stage surgery. His care team felt he would receive the best care if he traveled to Cincinnati. So he did. The surgery was successful, and he stayed for nearly 2 years while he recovered. Now he's able to go back home and get back to living.
I want to say a special thank you to Dr. Dickey and her whole team. They saved his life.
What I went through made me realize really important things. Who I can count on and what's important in life. Knowing that I can count on the doctors and experts here gives me comfort and makes me happy.
There are very few patients like Zsolt who want to share a story like his. I think he wants to educate and he wants to help other families and other kids like him that, there is hope. They can live normal lives.
Right now, I'm just taking a day at a time. I'm grateful and I'm hopeful.
Find out more about how, together, we're helping to change the outcome for kids all over the world. Visit cincinnatichildrens.org/colorectal.
Issue applied in Ecuador. Ecuador provides the scientific community with very relevant data on the allelic and genotypic frequencies that characterize the population, particularly for the genetic variants found in various genes associated with Hirschsprung disease. Conclusion. A timely diagnosis is important as it avoids complications such as enterocolitis and allows adequate definitive surgery with excellent long-term results. Thank you.